All right, welcome back to CBS This Morning. I'm Anthony Mason with Tony Dokoupil. Gayle King is off, so CBS This Morning Saturday co-host Michelle Miller is with us. Hospitals across the country are struggling to keep up as the number of coronavirus cases surges. The nation's largest nurses union says many hospitals are not truly ready for an influx of people who need to be tested and treated. Adriana Diaz is at Chicago's Northwestern Memorial Hospital. Adriana, why are nurses sounding the alarm?
Well, good morning, Anthony. Doctors here have been preparing for a potential outbreak, but National Nurses United says that nurses at other hospitals across the country are not getting all the tools they need to properly treat their patients and protect themselves.
We have found that hospitals are falling short when it comes to having enough of the protective equipment.
Sandy Redding is vice president of National Nurses United, the nation's largest nurses union. She says workers are not ready to handle coronavirus cases.
We need to have face shields, gloves, and special gowns instead of locking them up and having to request for them. We want to be able to react quickly and swiftly.
Leaders at Northwell Health's LIJ Forest Hills Hospital in New York say they are ready. Dr. Teresa Amato is the director of emergency medicine.
What we're doing right now is we're trying to screen for anybody that would be at a high risk. So just having a cough and a fever, sore throat, doesn't necessarily mean that you have the coronavirus. We would really want to know, have you been traveling? Have you been in contact with someone who has tested positive for the coronavirus?
To cut down on the risk of overcrowding, some hospitals are asking patients not to rush the emergency room.
First thing you should do is to call your own physician and speak to them over the phone and really get advice from them of what would be the next best step.
The number one thing we do is kind of assess their medical stability via this virtual visit.
At Rush University Medical Center in Chicago, doctors are now using virtual visits to prevent infected patients from entering the ER. Dr. Meeta Shah showed us how it works. Why has the hospital decided to do this?
I think it's really important that the patients get good education, be able to talk to a medical professional, while at the same time being able to stay at home.
When a patient's brought to the ER, they're typically dropped off here at the main emergency room exit. But any patient that's suspected of having coronavirus is taken to this specialized ambulance bay where they bypass the emergency room and they're taken straight up to isolation. Rush University Medical Center just cared for a person with a confirmed case of coronavirus. Chief Medical Officer Dr. Paul Casey examined him. How do you treat this patient and still protect doctors like yourself, nurses, staff?
So a couple of the ways that we've done that is we have iPads specially set up in the room, but if there's quick interactions that need to happen, they can actually do those from outside the room.
The CDC's latest guidelines for hospitals preparing for coronavirus include telephone advice lines and those virtual visits we showed you. Now, if you feel you've been exposed to the virus, doctors suggest calling the hospital ahead before showing up to reduce potentially exposing others.
Adriana, thank you. That makes perfect sense.
Oh, yeah. Give them a heads up. Let them put the masks on and be ready for you.
Yeah, and those teleconferences are a good idea, too.
Those are valuable.
Yeah, really are.